Hello and welcome. Today we're diving deep into a rare but serious childhood illness, Kawasaki disease. While the name might sound unfamiliar, understanding this condition is crucial for early diagnosis and treatment, which can significantly improve outcomes. The exact cause of Kawasaki disease remains a mystery. It's not contagious, and it's not inherited. Research suggests a combination of genetic predisposition and environmental factors may play a role. Some theories point to a possible infectious trigger, like a virus or bacteria, but no single agent has been definitively identified. Essentially, the disease appears to be an abnormal immune system response to an unknown trigger. Kawasaki disease primarily affects blood vessels, particularly the coronary arteries, which supply blood to the heart. The disease triggers widespread inflammation of these vessels, a condition known as vasculitis. This inflammation can weaken the vessel walls, leading to the formation of aneurysms or bulges. These aneurysms can rupture or cause blood clots, potentially leading to heart attack, stroke, or even sudden death. The inflammation also affects other organ systems, contributing to the diverse range of symptoms seen in Kawasaki disease. Kawasaki disease primarily affects children, usually under the age of 5. It's more common in boys than girls, and certain ethnic groups, particularly those of Asian descent, have a higher incidence. While Kawasaki disease occurs worldwide, it's most prevalent in Japan and Korea. The disease tends to occur in outbreaks, with peaks in the winter and spring months, although cases can occur year-round. The symptoms of Kawasaki disease can vary, but there are some key features. A high fever lasting for 5 days or more is almost always present. Other common signs include a rash, often on the trunk, red, cracked lips and a strawberry-like tongue, red eyes without discharge, swollen lymph nodes in the neck, and swelling and redness of the hands and feet. Irritability is also common in children with Kawasaki disease. It's important to note that not all children will experience all of these symptoms. Diagnosing Kawasaki disease can be challenging because there's no single definitive test. Diagnosis relies on clinical criteria, meaning doctors look for a combination of the characteristic signs and symptoms. Blood tests can help support the diagnosis by showing elevated inflammatory markers, such as C-reactive protein and erythrocyte sedimentation rate. An echocardiogram, or ultrasound of the heart, is also performed to assess the coronary arteries for any signs of aneurysms. Kawasaki disease is sometimes classified as typical or atypical. Typical Kawasaki disease presents with all the classic diagnostic criteria. Atypical or incomplete Kawasaki disease occurs when a child has fever and some, but not all, of the classic symptoms. Atypical Kawasaki disease can be more difficult to diagnose and may require a higher level of suspicion, especially in young infants. The primary goals of treatment are to reduce inflammation and prevent heart complications. Intravenous immunoglobulin, or IVIG, is the main treatment for Kawasaki disease. It's a concentrated solution of antibodies that helps to dampen the immune response. Aspirin is also used to reduce inflammation and prevent blood clots. In some cases, other medications, such as corticosteroids, may be used if IVIG is not effective. Early treatment is crucial. IVIG is most effective when given within the first 10 days of illness. Unfortunately, there's currently no known way to prevent Kawasaki disease. Since the exact cause remains unknown, identifying and avoiding potential triggers is impossible. The focus remains on early recognition of symptoms and prompt treatment to minimize the risk of long-term heart complications. With early diagnosis and treatment, most children with Kawasaki disease recover fully and have no lasting heart problems. However, in some cases, aneurysms can develop and lead to long-term complications. Regular follow-up with a cardiologist is crucial to monitor the heart health of children who have had Kawasaki disease. Recent research focuses on identifying the cause of Kawasaki disease and developing more targeted therapies. Studies are also exploring the role of genetics and environmental factors in the development of the disease, aiming to improve prevention and treatment strategies in the future.